Let's discuss spinal epidural abscess. Let's suppose a patient come to you with the history of intravenous drug use and complaints of back pain, low grade fever and lower extremity neurological symptoms. This should raise strong suspicions for the spinal cord compression, which might be due to spinal epidural abscess. Spinal epidural abscess is a bacterial fluid collection in the epidural space. It usually occurs in the setting of bacteremia due to either intravenous drug use or could be from the distant infection, for example, endocarditis. The risk is greater in those with immunocompromised immunity, for example, HIV. Because the epidural space is a narrow, there is contagious corridor within the spinal canal where the bacteria can invade and tends to affect multiple adjacent spinal levels and to eventually compress the spinal cord. The classic triad for that you need to remember is the fever, spinal pain, and neurological deficits. And this is a classic triad which can be given to you in the question vignette. Most individual develops the symptoms like fever, malaise in few days, 2 weeks, and then there will be a progressive neurological deficits, and that would be first there will be the worsening of the focal back pain, which would be evident by spinal tenderness to palpation. Then there will be a radicular nerve pain, which will be described as shooting pains in the lower extremities. Then there will be sensory motor or the reflex deficits, for example bilateral leg weakness and upgoing plantar flexor, and then there will be bowel or the bladder issues, and finally paralysis. To confirm the diagnosis, suspected cases require urgent spinal MRI with contrast, followed by antibiotics and surgical decompression to prevent the neurological sequelae and death. Thank you.